So how do we actually treat an injury and sort it out? Okay, well, number one, pain. So the reason someone comes in is usually because they're in pain, either discomfort or pain, and then they notice other associated factors with it sometimes, so like being out of line, or you know, the muscle feels really tight, or they feel a grinding sensation, or something similar. Yeah, they're worried about something. So number one is to investigate what that is. Right, pain is a bit fucking complicated. So let's take lower backs. So in lower backs, if you MRI'd people's spines, about 70 to 80% of people with no real objective pain, nothing serious, you would see something significant clinically. So it could be a disc bulge, it could be some stenosis of the spine, that's closing of the hole where the spine works through. It could be a bone spur, something along the lines, and they're in no pain. And then there's people who are in seething pain with the back, and then you scan the back and there's nothing wrong, so they look like liars, which they aren't. They are experiencing the pain. All pain is experienced in the brain, so it doesn't matter if it's in your head or not. It's every bit of sensation you ever feel is technically in your head, and your brain's making sense of what's going on in the body. The nervous system is effectively your brain, and then the spinal cord, and then the tentacles. They allow things to work and be controlled, but also feel and give feedback. So when you're talking about pain, different tissues in your body run on different pain networks, and it's not so much pain you're dealing with something called nociception. So it's a feeling of stimulus. That could be heat, it could be cold, it could be pressure. In small amounts it won't be classed as painful, in high amounts it's classed as pain. What happens is the feedback comes up different tracts of the spinal cord from the feeling tentacles of the tissues which are having strain or chemical irritations placed on them, and then your brain makes sense of it. However, the thing what you want to know is, as it comes through your brain, it will work through different regions of the brain, and it will work through more primitive emotional centers first before it comes to the rational centers of the brain to make sense of it. So if you have a mood disorder, if you are tired, stressed, any of those, your pain will be exacerbated, your immune system will be more compromised, and it'll get to you more. So that's one thing to think about. The other thing is beliefs and imagery around what's happening in the body. So this is a big one when you go to the doctors and they say your back is grating, it's wear and tear, the bones are rubbing on each other. Yeah, it sounds really bad, and you visualize that, and then the body your brain will turn up the volume in that area and make it more sensitive, and you'll be more guarding, and then the guarding muscles, the tightness, will start to cause secondary aches, muscle aches and pains. So one of the first things you need to do is look at what you're dealing with and have someone who understands pain science, and that will depend on the practitioner where they've trained. I personally have looked heavily into pain science, so to a decent extent for clients. So I'd say I tick that box. Understand pain. There's a good book and there's a good video series by Dr. Mosley, I think it is, something similar to that, called Explain Pain, and this goes into this. When you've had pain for quite a long time, not just like, smacking your knee on the table and it hurts, if you've had pain for more than 3 months, that becomes something called chronic pain. So a normal tissue injury should start to recover, if it's going to recover in itself, within probably about 12 weeks. If it's a disc in your back, maybe 6 months. But the longer you have pain, the better you get at feeling that pain. So it becomes sort of part of your personality. It's wired into you, and part of the rehab is understanding where you are and then breaking up that pattern. So what I like to do first of all is a 5-step process. The intro's out of the way now. Is number one, understand and reduce pain. There's many ways to do this. If it's acute, so you have a recent muscle tear or you have a recent thing what's really swelled up and angry and your body's trying to heal the thing, anti-inflammatory protocols, so the ice, the say non-steroidal anti-inflammatory drugs, you need to have them at least for 3 or 4 days in a good amount. Otherwise it's just light pain relief. It's not actually going to be working on inflammation. It's just working on light pain relief. And you need to have a proton pump inhibitor like omeprazole or lansoprazole with it. There's also light tissue work and light movement and isometric exercises to try and desensitize that area. You know, there's acupuncture, a number of therapies to get pain down and tone that thing down. Yeah, lightly stretching if it's required. Sometimes if you've strained the muscle, stretching it was the mechanism of injury, so you're just going to re-annoy the fucking thing. So there's that. Get pain down, understand why. Direct local pain, what's there. Is it more chronic in the brain beliefs as well as, or is it more tissue based? That's what you want to grasp. And then when you understand each tissue, you'll understand what type of pain that tissue gives. So a muscle pain might be like a dull ache, a tendon pain might be a sharp pain on loading, and it might ache and throb when you start to use it. Ligaments might not hurt, but your joint may be unstable, and then the joint starts to hurt because the ligament, the seatbelt of the joint's not doing its job. Bone, again, can be a dull ache, shooting pain through, usually from more impact, or, you know, it's really quite severe bone pain. And then we can check that out through different ways, like Tinel's test, tapping it, or using a tuning fork, or x-rays and things. Nerve pain is on a spectrum, and we'll go into that in a bit because it's quite fucking complex, nerve pain. They're going to be the main tissues. These are the things we can look at. So then when we've got that assessment and we've done that, what we want to do is reduce that pain. When that's reduced, the body and the idea of the body and how you use things and the guarding you have is going to be less deranged and less problematic. It actually stops you getting relief from the problem. Okay, so pain can be functional or dysfunctional, and that's what we want to get. The next stage, so stage 2, okay, if you think about how the body works and the balance of the body, if you're looking at muscles, joints, way things are sat, way things are functioning, there'll be certain patterns what are already favoured. And if you've got an injury, especially one what didn't have an obvious cause, like, you know, a fall or trauma, everything you've done up to this point has led you to have this problem now. So if you don't change the pattern what you've had before, why would it change? It's not just random. It may seem random because you can't understand it, but there's a reason your body has picked this to be your weak point. You know, it could be genetics, it could be what you're doing every day as a job. If what you're doing is just repetitive in one motion, it's just more friction and more wear on the area. That makes sense. It could be what you're doing in sport. It could be your muscle strength and mobility, balance or imbalance is what you have. Yeah. So what we want to come and do is loosen off first what is too tight. And when I say that, that could be mobility in tissue work and using mobilizations and manipulations to joints. We can use traction. We can use a number of different things. Isometric exercises can take the brakes off joints and things which are weak and holding on because they're weak. But ultimately we want to loosen off what is too tight first. Otherwise the things what aren't doing their job, which is in stage 3, we want to then start to implement the physio, or what people would think would be physiotherapy, which would just be direct strengthening exercises and exercises which change patterns. Your body will use what is already strong or already dominant or already favoured. Your body seeks efficiency, which is more or less synonymous with being lazy. So it's easier to sit in poor posture than it is to sit upright. That is a function to save energy. It's easier to lay down than stand up. It's easier to, take shortcuts. So you're not a bad person for doing that. It's just the way a lot of our default networks are wired up, okay? But if you don't loosen off what is already dominant and try and inhibit it or down-regulate the activity of it, the ones what are struggling to kick in to rebalance yourself aren't going to be able to do their job. You're going to make it even harder. So in my experience, get the pain down, because nothing works right when it's really acute, especially, and poor beliefs are happening and nothing else is happening. So get the pain down. Then look at the wider picture and look at why that was predisposed, and down-regulate everything what's working too much. Help the patient understand it. The third thing would be to then tighten up what is too loose. And effectively that's just strengthening up. Sometimes things aren't weak, they're just relatively weak to the person, or they aren't kicking on at the right time, in the right sequence. So stored in your brain and spinal cord, are something called motor engrams. And that is effectively it's like you've saved it, you've saved the pattern on how you are going to move. Nearly every movement you do, you don't really have to think about it. Like I'm driving now, I don't have to tell my thumb or my index finger or my rotator cuff in the shoulder, the lat, the pec, to move this steering wheel. I take it for granted that I know how to move it and how much pressure to apply. So that's a stored pattern. When you're learning a new skill, part of it is subjugating yourself to new patterns until you do it until that becomes default, and that's when you become competent. So you have stored patterns in your body. If you always lift in an inefficient way, if you always move your scapula and shoulder blade in an inefficient way, you will be putting undue loads on certain areas, and you will find a weak point if you test your body out enough, either through just age, testing your body out over volume of years at work, or testing it out in sporting endeavours, and that's where the little intricacies matter a lot more. So when we're talking about strength and loosening up what's too tight, we also mean practicing the good movement, so you feel it and you get a bodily awareness of the issue, okay? So stage 4, if you've made it this far, we're doing well. I need to cut my nails. Stage 4. Now, so we're doing all this, and this is over like a 6-week, 12-week period, it's starting to happen. What we then want to do is learn how to integrate this new pattern into our everyday lives or back into our sports. When the issue seems to subside and we're working and we're seeing progress on tightening things up, we're seeing objective decreases in tightness, pain, sensation, mobility, what we then can do is start to generally train, because we now have a more stable, even base. We haven't got 10 pillars and 2 of them aren't doing the job and then 2 of them are too high. So we're building effectively what's on the piss. If we get that as even as possible, or well, as possible, not everything is fully able to get fully even, we can then start to load with all of the history of what we've just done in mind. So this is where doing, gym work with compound lifts, barbells, or more sport specific work comes in. You continue to do this and push, which leads to stage 5, which is effectively, having done the gift of injury, we then start to optimize the body even more than people who've never had an injury, because they've never realized how much they could change things and what their patterns are. So then you can start to actually thrive and become even more athletic or better than you were before. With this method, if it's fixable, it will be fixed. If it's not fixable, you'll have to learn how to manage things. So if you've had a trauma, an accident, or there's something what just cannot be changed in the process, what keeps happening, a good practitioner will also relay this to you and learn you how to do your best. And there's nothing what's really a quick fix for everything. There's things what can take you back under the symptom threshold. So say like you're doing 5% bad posture, 10% lifting shit at work, 20% you've got a really weak core and really weak muscles, and then you go and pick someone up in the garden, and over that last 2 years you've been annoying your disc and your L5S1. You sneeze while you're smelling your flowers in the garden or potting a plant, and then it's taking you out. Oh my god. So that's going to take some unraveling and some learning, and that's why a lot of people as well, because it's quite complex, don't get better because they haven't got that understanding, and they're searching for a simple answer to a fucking really complex problem. It's not just the thing what hurts, it's not just the thing what's broke, what is the issue, what's a quick one thing fix, because they think they were fine up to that point, but really they were causing the problem low grade over a period of time. And if they aren't willing to change that, they probably aren't going to improve, and it's going to be just the way it is. But if you are one of them proactive people and you do actually want to change things, there's a fucking lot you can do, even with like a condition what is reoccurring, and it's a condition what takes a lot of time. It's fucking annoying and it's not fair, but you could get knocked over by a bus, you know, you could be struck by lightning, like, you know, just look at your life where you are and accept it for where you are, and then make a decision if you want to be fucking proactive or not, and do something about it. If you don't, just fucking moan. It's not going to do you any good. It might justify where you are. These people who I consider really unlucky and in a worse position than say me, and they don't moan, and I've moaned before. Well, they don't moan much anyway, but they're more positive in certain ways. We're all emotional, we all get fucked off, and pain can really fucking ruin stuff for you. But if it's something you can't change as well, one thing I've read before, I think it was Richard Branson who said it, expert on pain apparently, is if there's something you can't change, you just change the way you think about it, and that is a good thing to do. Having your body looked at and putting some time into it, it's a really good investment. It's the only vessel you get to experience life, so try and optimize it like you would a car, what you care about, or like you treat a friend or your child. Try and treat yourself like you matter and you mean something, yeah? So if you want any help, right, not really a plug, I have a free group if you want to ask things, if you're not anywhere close, or you want to just have a little bit of insight about a problem. I'll answer that within 48 hours usually, okay, on Facebook. But if I want it to grow, I want it to be the biggest one on Facebook of its kind, and actually give some proper help out, and I'll run free mini modules and mini courses where you can make it simple. The second thing is, if you do want to book in, if you do want help, literally on the Tough Body University page, just go on the bio and book when you want. If it's not for you when you get here and we do a quick assessment, I'll just give you half the money back, or the full money back if it doesn't take me long. So if you're not sure, I can't answer lengthy things in the DMs about your problem, because that is my work and Paul's work, the guys who work here, okay? The assessment and the thought process behind it, working out your issue, is the reason why we are where we are, and that's what makes it work. Anyone could learn the techniques of osteopathy, physiotherapy, the movements, whatever, but it's just like having a tool and then going and try and be fucking Michelangelo and make, you know, like creating the artwork on the Sistine Chapel. You can have all the same tools and watch a couple of his techniques, but you can't put it together properly. You're not going to get, you know, some amazing work like we try and do. There you go to school, that, comparing themselves to Michelangelo. But anyway, we try and do a good job. So you can go and see someone who's going to rub the thing and just keep guessing, but really you're just wasting fucking time. In the meantime, you could be going backwards, getting worse, and ultimately you're just maintaining the problem. Like, it's arrogance, but there's only really you that suffers. So you want something looking at, and it's not for us. We also have people who we can send away or recommend certain surgeries, medications, other weird things, and collaborate with people who think outside the box and know the box inside and out in this game. So hopefully this is clear. The next video, I think I'm going to work into like the models, what I work on. This has been the first model. This is probably, someone else has probably made it, but I call it my 5-step model, like body MOT 5 steps. There's other models and methods to think about things, but the thing that makes you good, not just the tools, the models as well. You need to know when to switch from one to the other, and what you're dealing with, and how that's going to react, and how that's going to fit in. So here we are. Hope this helped. Listen to it a few times if you need to listen to it a few times. Feel free to share, do whatever. The YouTube channel is just a bank of information where people can come and just have a little sift through. It's not filtered and polished. It's just good raw information. And for the person who listens through and tries to implement it, this is really going to help. Okay, hopefully you can hear it as well over the driving around in the car. I've had some driving to do, so I thought I'd multitask. Catch you all later. See you.